Most people have never heard of hantavirus, but doctors and health experts consider it one of the most dangerous viruses you can accidentally encounter inside your own home, garage, cabin, or even while cleaning a dusty storage room. What makes hantavirus truly frightening is how quietly it spreads. You don't need to be bitten, you don't need close contact with a sick person, and in many cases people don't even realize they were exposed until the symptoms suddenly begin. Imagine cleaning an old shed, sweeping out a garage, opening a forgotten box in the attic, or staying in a cabin that looked perfectly safe. Everything feels normal, nothing seems dangerous, but hidden in the dust could be tiny particles contaminated by infected rodent droppings or urine, particles so small you can breathe them in without ever noticing. And once the virus enters the body, the early signs can look almost harmless. At first, it may feel like a simple flu. You feel tired, your muscles ache, you develop a fever, maybe headaches, maybe chills. Most people assume it's just a seasonal illness or exhaustion. But then something terrifying can happen. Within days, breathing may suddenly become difficult. The lungs can begin filling with fluid. The body struggles to get enough oxygen. And for some patients, the condition becomes life-threatening very quickly. That's why experts often call hantavirus a silent threat, not because it spreads everywhere like common viruses, but because people usually don't recognize the danger until it's already serious. And here's the shocking part. Many hantavirus infections happen during completely ordinary activities: cleaning basements, entering old buildings, handling firewood, camping, visiting rural cabins, working in barns or storage areas, even opening spaces where rodents have been living unnoticed for months. The virus is strongly linked to rodents, especially certain wild mice species. When infected rodents leave droppings, saliva, or urine behind, the virus can remain in the environment. If disturbed, tiny contaminated particles can become airborne and enter the lungs. That's why health officials repeatedly warn people not to vacuum or sweep rodent droppings directly, because that can push dangerous particles into the air. And many people accidentally make this mistake because they simply don't know the risk exists. Another reason hantavirus is so dangerous is that there's no quick way to recognize it at home. Early symptoms overlap with many common illnesses. Some people ignore the warning signs until severe breathing problems begin. In rare but serious cases, patients may require hospitalization, oxygen support, or intensive medical care. Now, this doesn't mean people should panic every time they see a mouse, but it does mean awareness matters, because understanding how hantavirus spreads can help reduce exposure and possibly save lives. In today's video, we'll break down what hantavirus actually is, where it comes from, how it spreads to humans, the early symptoms many people ignore, the cleaning mistakes that increase risk, and the important safety steps experts recommend to help protect yourself and your family. Some of these facts may surprise you, especially if you spend time in garages, farms, cabins, storage spaces, or older buildings. And near the end of this video, we'll also explain the warning signs that should never be ignored if someone begins feeling sick after possible rodent exposure. Because with hantavirus, recognizing the danger early could make all the difference. Hantavirus is not a virus most people think about in everyday life. Unlike the flu or common infections people hear about constantly, hantavirus stays mostly hidden from public attention. But health experts continue to warn about it because even though infections are rare, the virus can become extremely serious once symptoms begin. What makes hantavirus different is the way people are exposed to it. Many dangerous illnesses spread from person to person through coughing, sneezing, or close contact. Hantavirus usually works differently. In most cases, the virus spreads through contact with infected rodents and the contaminated areas they leave behind. This is why many infections happen in completely ordinary places. A person may clean an old garage after months of leaving it closed. Someone may open a dusty cabin before summer vacation. Another person may enter a shed, basement, attic, barn, or storage room where rodents have quietly been living for weeks or even months without anyone noticing. At first, nothing seems dangerous. There may only be a few small droppings in a corner, a little dust on the floor, a strange smell in the room. Most people simply grab a broom or vacuum and begin cleaning immediately. But this is where the hidden danger can begin. When infected rodent urine, droppings, or saliva dries out, tiny virus particles can mix into the dust. If the area is swept or vacuumed aggressively, these microscopic particles can rise into the air. Once airborne, they can be breathed into the lungs without the person ever realizing it happened. That is one reason hantavirus is often described as a silent threat. People usually cannot see the virus. They do not feel exposure happening, and symptoms often do not appear immediately. In North America, health officials say the deer mouse is one of the main rodents linked to hantavirus infections. These mice may look harmless and small, but they can carry the virus without appearing sick. The virus remains in their urine, droppings, and saliva, contaminating places where they live or search for food. This is especially important in rural areas, farms, cabins, camping sites, wood storage areas, and buildings that stay closed for long periods. Many people believe hantavirus only affects workers in dangerous environments, but infections have happened to ordinary families, travelers, hikers, and homeowners. Even people cleaning vacation homes after winter have become infected. One of the biggest problems with hantavirus is that early symptoms often look very normal. In the beginning, many people think they simply caught the flu or became exhausted from work. The first symptoms may include fever, fatigue, headaches, chills, and muscle pain. Some people also experience nausea or stomach discomfort. Because these symptoms resemble many common illnesses, most people do not immediately suspect something serious. But in some cases, the condition can suddenly become much worse. After several days, breathing problems may begin. The lungs can start filling with fluid, making it difficult for oxygen to move through the body properly. Patients may feel chest tightness, shortness of breath, or severe weakness. This stage can become dangerous very quickly. Doctors consider early medical attention extremely important because severe hantavirus infections may require hospitalization and intensive care support. The frightening part is how fast symptoms can change. Someone who feels like they have a simple fever one day may suddenly struggle to breathe a short time later. That is why awareness matters so much. Most people are never taught how hantavirus spreads or how to safely clean rodent-contaminated areas. Many unknowingly increase the risk by vacuuming droppings, sweeping dry dust, or touching contaminated surfaces without proper protection. Health experts recommend a very different cleaning approach. Instead of sweeping dry droppings, contaminated areas should usually be ventilated first. Protective gloves and disinfectants are often recommended to reduce airborne particles. Careful cleaning methods help lower the chance of breathing contaminated dust. Simple prevention steps can make a major difference. Sealing holes where rodents enter buildings, storing food properly, removing trash carefully, and keeping storage spaces clean may help reduce rodent activity around homes and cabins. And for people who spend time outdoors, awareness becomes even more important. Campers, hikers, and people staying in unused cabins should always pay attention to signs of rodent activity before settling into an area. Because sometimes the most dangerous health risks are not the ones people can easily see. And hantavirus is one of those hidden dangers that can quietly exist in places people normally consider safe. One reason hantavirus becomes so dangerous is because many people do not realize they were exposed until symptoms begin appearing days or even weeks later. By that point, the virus may already be affecting the lungs and immune system in ways the body struggles to control. This delayed reaction is what makes hantavirus so frightening to health experts. A person may clean a dusty shed and feel completely normal afterward. Life continues as usual. Nothing seems wrong. Then suddenly, several days later, symptoms begin. At first, the signs often appear mild. The person may wake up feeling unusually tired. Muscles begin aching, especially in the back, legs, and shoulders. Fever and chills may appear. Some people develop headaches or dizziness. Others experience nausea, vomiting, or stomach pain. Because these symptoms look similar to many common illnesses, most people assume they have the flu, food poisoning, or a temporary infection. And this is where the hidden danger grows. While the person believes they only need rest, the virus may continue affecting the lungs internally. As the condition progresses, breathing problems can begin very suddenly. Many patients describe feeling as though they cannot take a full breath. The chest may feel tight or heavy. Walking short distances becomes exhausting. Some people feel like they are drowning even while sitting still. This happens because fluid can begin leaking into the lungs, making it harder for oxygen to move into the bloodstream. When oxygen levels fall, the body becomes extremely stressed. The heart works harder. Weakness becomes severe. In serious cases, patients may require emergency medical treatment, oxygen support, or intensive care. That is why doctors stress the importance of recognizing symptoms early, especially after possible exposure to rodent-contaminated environments. Now, not every mouse carries hantavirus, And not every exposure leads to infection. But the risk becomes more serious in places where rodent activity is heavy and cleaning is done carelessly. One of the biggest mistakes people make is using a vacuum cleaner on rodent droppings. Vacuuming can spread tiny contaminated particles throughout the air inside a room. Sweeping dry droppings can create the same problem. This is exactly why health experts warn people to avoid disturbing contaminated dust directly. Instead, experts often recommend first ventilating the area by opening doors and windows for a period of time. Protective gloves, disinfectants, and careful cleaning methods are usually advised to reduce airborne exposure. Many people are surprised to learn how important proper cleaning becomes in preventing hantavirus. Even simple habits matter. Washing hands carefully after handling storage items, avoiding direct contact with droppings, wearing protection when cleaning enclosed spaces, sealing holes where rodents may enter buildings. These small precautions can help reduce risk significantly. Another important fact about hantavirus is that infections are more common in certain environments. Rural areas, farms, barns, woodpiles, camping sites, abandoned buildings, and seasonal cabins often attract rodents looking for food and shelter. During colder months, mice may move indoors more frequently, especially into garages, attics, basements, and storage spaces. That means some people unknowingly spend time in contaminated areas without recognizing the signs. Rodent droppings, shredded nesting material, unusual smells, chewed food containers, and scratching sounds inside walls can all suggest rodent activity nearby. Ignoring these signs can increase the chance of exposure over time. And while hantavirus infections are considered rare, the seriousness of the illness is exactly why awareness matters. Most people do not think about dangerous viruses while cleaning a garage or opening an old cabin. But understanding the risk allows people to take safer precautions before exposure happens. Another reason hantavirus receives attention from health experts is because there is currently no simple cure that immediately stops the illness once severe symptoms develop. Treatment usually focuses on supporting the body while doctors manage breathing problems and complications. That is why early medical attention becomes extremely important. Anyone who develops flu-like symptoms after possible rodent exposure should never ignore worsening breathing difficulty or chest tightness. Recognizing the connection between symptoms and recent exposure may help doctors respond more quickly. And perhaps the most important lesson about hantavirus is this: dangerous health threats are not always obvious. Sometimes risk hides in ordinary places people feel completely comfortable entering every day. A dusty attic, an old shed, a quiet storage room, a vacation cabin closed for months. Places that appear harmless can sometimes contain hidden contamination people never expected. That is why awareness, caution, and safe cleaning habits remain some of the most important tools for protecting yourself and your family from this silent threat. One of the most important things to understand about hantavirus is that prevention matters far more than panic. Most people who learn about the virus become frightened because of how serious the illness can become, but health experts repeatedly emphasize that awareness and safe habits can greatly reduce the risk of exposure. And that begins with understanding where rodents are most likely to hide. Mice are constantly searching for food, warmth, and shelter. Small openings in walls, roofs, garages, sheds, and cabins may allow them to enter buildings without being noticed. Once inside, they often stay hidden behind boxes, furniture, storage containers, insulation, or inside walls. Because rodents usually avoid people, many infestations remain unnoticed for long periods. A person may only discover signs of rodents after opening an old storage area or moving forgotten boxes that have not been touched in months. This is why experts advise people to stay alert for warning signs before cleaning enclosed spaces. Droppings on shelves or floors, chewed food packaging, shredded paper or fabric used for nests, strange odors, scratching sounds at night. All of these may suggest rodent activity nearby. And if those signs are present, cleaning should be approached carefully instead of rushing in immediately with a broom or vacuum cleaner. Health experts recommend allowing fresh air into enclosed areas before cleaning begins. Opening windows and doors helps reduce the concentration of airborne particles inside the space. Protective gloves are also commonly recommended because rodent waste may contaminate surfaces people touch directly with their hands. Disinfectants and damp cleaning methods are considered safer than dry sweeping because moisture helps prevent contaminated dust from spreading into the air. These precautions may seem small, but they can make an important difference. Another major step in prevention is controlling rodent access around the home. Small holes near pipes, doors, roofs, and vents can allow mice to enter surprisingly easily. Sealing openings and removing food sources may help reduce rodent activity indoors. Food storage matters as well. Open containers, crumbs, pet food, and garbage left exposed may attract rodents into garages, kitchens, sheds, or storage areas. Keeping food sealed properly helps make buildings less attractive to mice searching for easy meals. Outdoor areas also deserve attention. Wood piles stacked close to homes, cluttered storage areas, tall grass, and accumulated trash can create hiding places where rodents feel protected. Reducing these shelter areas may help lower rodent populations nearby. Now, another important point many people misunderstand is the difference between caution and fear. Hantavirus is serious, but it remains relatively uncommon. Most people will never experience infection. The goal is not to create panic every time someone sees a mouse. The goal is awareness, because awareness changes behavior. People who understand the risk are far more likely to clean safely, ventilate closed spaces properly, avoid disturbing contaminated dust, and pay attention to symptoms if exposure may have occurred. And this awareness becomes especially important for people who spend time in higher-risk environments. Farm workers, campers, hikers, cabin owners, construction workers, storage facility workers, people cleaning abandoned buildings. These situations may increase contact with rodent-contaminated spaces more than typical indoor environments. Travelers staying in cabins or rural vacation homes should also pay attention before unpacking and settling into a room. Looking for signs of rodent activity first may help reduce unnecessary exposure. Another thing health experts stress is the importance of listening to the body after possible exposure. Many illnesses begin with mild symptoms, and hantavirus can appear similar at first. But if fever, muscle aches, severe fatigue, and especially breathing difficulty begin after contact with rodent-contaminated environments, seeking medical attention becomes very important. The connection between symptoms and recent exposure may help doctors evaluate the situation more quickly. And early care can matter greatly when breathing problems begin developing. One reason hantavirus has gained public attention over the years is because the illness reminds people how hidden some health risks can be. Danger is not always loud or obvious. Sometimes it exists quietly in places people rarely think about. An attic covered in dust, a garage closed for winter, an unused cabin in the woods, a basement storage room, places connected to normal daily life. That is why education matters so much. Simple knowledge about how hantavirus spreads may help people avoid risky cleaning habits and recognize warning signs earlier. And while many people focus only on rare diseases after hearing frightening stories online, health experts continue repeating the same message: most protection begins with practical prevention. Cleaning, proper ventilation, rodent control, protective equipment, careful hygiene, awareness of symptoms. These steps may sound simple, but they are often the most effective tools people have. Because when it comes to hantavirus, prevention is always safer than treatment after severe symptoms appear. And perhaps the most important lesson of all is this: many serious health risks can be reduced when people stay informed instead of assuming ordinary situations are automatically harmless. Understanding the danger does not mean living in fear. It means being prepared enough to protect yourself wisely. And sometimes that awareness alone can make all the difference between a safe cleanup and a hidden exposure that could become far more serious later.